For leptospirosis, serology is the most suitable diagnostic method because direct detection of leptospira are slow and has limited reliability. It is usually diagnosed by the detection of antibodies by culturing bacteria from blood, urine, or tissues, or by demonstrating the presence of leptospira using the antibodies labeled with fluorescent markers. Other diagnoses are PCR and immunostaining. Next, microscopic agglutination tests can also be used to detect the leptospira. ELISA is operated based on the genus-specific antigen. It has a weak cross-reaction due to the presence of other diseases may be observed. In dark field microscopy, leptospira are observed as thin coil-moving microorganisms. It is also technically demanding. Basically, the examples of prevention are do not swimming in water that are contaminated with animal urine, wear protective clothing, and provide animal vaccine for pets.
Lastly, we're going to some discussion about our topic leptospirosis. So, are the preventive measures good enough? It is good, but more can be done. For example, additional steps should be taken such as filtering and disinfecting water with chlorine and iodine before consumption, especially in rural areas. Also, people traveling in the endemic areas can consider taking doxycycline supplemental. Next, what worked and what did not? Well, although appropriate protective clothing is important, it is however not enough as these tiny spirochetes can easily go through clothing and come in contact to open wounds or abrasion on skin. Thus, clothing does not totally prevent leptospirosis. What else can be done? Well, further research should be explored as the pathogenesis is still not entirely understood. Also, the government plays an important role in educating the people who live in areas that has rampant cases of leptospirosis. Therefore, the government has to fulfill its responsibilities to raise awareness among the public. Is the current diagnosis method good enough? Are there any other methods? Our answer to that is the microscopic agglutination test is still one of the best known methods to date. This method is very specific for serial diagnosis of leptospirosis, and it uses live samples that is freshly isolated from patient as well.
In summary, leptospirosis is not a new disease in Malaysia, but has been around since 1925. Its recurrence in the recent years proves to be a source for concern. Therefore, the Malaysian government should continue to work out measures to tackle this infection so that its incidence does not continue to rise. Although there are antibacterial treatments available, there is yet to be a vaccine available for prophylaxis treatment of leptospirosis in humans, so it is essential for the general public to be informed of steps to take to prevent the spread of leptospirosis in the country.
Created using Powtoon.